Hi, this is Mrs. Lewicki, and I'm talking to you about the exemplar and cellular regulation of cancer. So I'm going to start with a few terms for you. Neoplasm is a mass of new tissues that is growing free from surrounding structures and has no physiologic purpose. It does require a blood supply to sustain growth. When we're looking at neoplasms or cancers, we're looking at, are they benign or are they malignant? Benign means it does not endanger life or health, and malignant, it will recur, continue to grow, and spread to other parts of the body if not treated, and it results in death. Contact inhibition is a process in benign tumors that will stop growing when they come in contact with another structure or organ boundary. Invasion is the process of tumor cutting through and invading tissues and organs, causing bleeding, inflammation, and necrosis. Metastasis is the spread of a malignant tumor to other areas of the body. And chemostaxis is movement of cells in response to chemical stimulus. When we're looking at the pathophysiology and etiology of cancer, we look at them differently with the benign neoplasms and malignant neoplasms. Benign neoplasms are localized, gross. They have well-defined borders, or sometimes they'll say that they're encapsulated, which means they're fully contained in that capsule, so to speak. They respond to hemostatic controls. They stop growing when they reach other boundaries, and they grow slowly and stable in size. Generally, they don't have reoccurrence once they're removed. They're typically harmless, but may cause pressure on organs. Like, for example, a meningioma, which is a neoplasm in the brain, it can cause pressure on the brain, which then could cause other issues to happen. Malignant neoplasms are aggressive. They don't respond to hemostatic controls. They're not cohesive, and they're irregular in shape. They can cut through surrounding tissues. There are no boundaries that stop them. They cause bleeding, inflammation, and necrosis. They travel through blood or lymph and invade other tissues and organs. They may form secondary tumors, and that's metastasis, and they can recur even after surgical removal. This is what I just said, comparison of benign and malignant. This is from a chart in your book, and I'm not going to read the chart to you. Characteristics of a malignancy is its rapid cell division and growth of the tumor. It can produce hormones and enzymes in excessive amounts. And depending on where the tumor is, so whatever organ hormones there are, it may be excessive amounts of that. It easily invades and destroys other tissues. There's clear mutation of what the cells look like. Recall in cellular regulation that cells should have certain characteristics. And what happens in cancer or malignancy is the cell mutates. It's irreversible. There is an altered cell structure, so there's differences in the nucleus and the cytoplasm as compared to the typical cell of that organ. They have simplified metabolic activities, so if they invade, let's say, the ovaries, the tumor invades the ovaries, it's not going to do the same job as the ovary does. Or if it invades the liver, it's not going to function the same. They can travel to other locations or metastasize and establish new growths, promote their own survival. So they produce their own hormones and increase their blood supply in order to promote their own survival. They secrete a growth factor that stimulates blood vessels to grow into the tumor and divert nutrition from the host. Aggressive tumors may cause atrophy and necrosis of adjacent tissues. They impact the cell membrane and secrete enzymes that degrade the physical barrier, thus facilitating movement into normal tissue, lymph, and blood circulation. Motility is they're less tightly bound to each other, so they easily separate and move into surrounding areas. Again, they don't have any boundaries that are limiting to them. Chemotaxis again, is what draws the tumor into healthy tissue. Metastasis is when malignant cells move through the body or lymph into another area, and they clump and form emboli, travel until they're too big, and then invade the tissue. So you could have a breast cancer that metastasized to the bone, or you could have a liver cancer that metastasized somewhere else. They survive in the cells in the blood, and extravasation from the circulation implant in new tissue. And 50 to 60% of all cancers have metastasized by the time the primary tumor has been identified. So for metastasis to occur, the cancerous cells must avoid detection by the immune system. They can escape detection in several different ways. So sometimes the cancer cells are very aggressive and they grow too fast to be recognized. The immune system doesn't have time to do that. And sometimes they're recognized as foreign by the immune system. They must display on their surface a special antigen called tumor-associated antigen. Some tumors are in advanced stage of growth, no longer display the TAA. Thus, tumor cells escape detection as they travel through the blood or lymph. If they have a weakened or altered immune system, the metastatic tumor may take hold with little opposition. The immune system, when it discovers a neoplasm, it tries to destroy it using the resources of the body. And it's an all-out assault on the foreign invader, calling on the resources including chemical mediators, hormones and enzymes, blood cells, antibodies, proteins, and inflammatory immune responses. These protective responses also mobilize the fluid, electrolyte, and nutritional systems, and the massive effort requires tremendous energy. If the neoplasm is small enough, the immune system can destroy it, and a tumor will never manifest itself. A neoplasm of 1 centimeter is large enough to overwhelm most immune system. However, the body will continue to fight until it reaches the stage of exhaustion and is no longer capable. Thus, many patients with cancer present with fatigue, weight loss, anemia, dehydration, and electrolyte imbalances. There are some causative agents for tumors, and those include external agents such as chemical, radiation, and viruses, and internal hormones, immune conditions, inherited mutations. Genotoxic tumors will alter the DNA and cause other mutations. And there's a promoter substance and other adverse biological effects. And viruses that can lead to cancer include herpes, HCMV, Epstein-Barr virus, hepatitis B, papillomavirus, and HTLV. There are risk factors and prevention for cancer. Risk factors include hereditary. The older we get, over 50 and more, the more likely we are to develop a cancer. Gender is dependent on the type of cancer, because some cancers men get more than women and some women get more than men. Poverty and low socioeconomic status do affect this. Stress is not a proven link, but is often associated with development of cancer. We talked in cellular regulation, diets high in nitrates and smoked meats and fried foods, they're at a higher risk for cancers. Occupation and risks vary depending on what type of area you work in. Infection, tobacco, alcohol use, recreational drug use, obesity, and sun exposure are also risk factors. Prevention is to live a healthy lifestyle, avoid smoking, limit alcohol intake, eat a balanced diet, exercise, and wear sunscreen. Clinical manifestations wherever are going to vary depending on where the tumor is, but there will be a disruption of function of whatever that area is. So it impairs normal function of organ or body system. There may be hematological alterations because it impairs normal function of the blood cells. They may have frequent infections. They may have hemorrhage. Anorexia cachexia syndrome is a wasting syndrome, in which the person is malnourished, weight loss. They may even look like they're in a starvation state, and they have a reduction in their basal metabolic rate. Paraneoplastic syndrome is triggered by an altered immune response. It's pretty rare, and antibodies start to attack the tumor. Other clinical manifestations include pain, and cancer pain is considered acute or chronic. Acute, some common signs and symptoms include hyperactivity of the, common signs and symptoms of pain. And there may be a hyperactivity of the autonomic nervous system. Chronic is pain that lasts more than 6 months, and it can lead to personality changes and lifestyle disruptions. Also, other clinical manifestations of cancer include psychological stress. They may have a profound emotional response and may feel overwhelming grief. Oncological emergencies include metabolic. What happens is there's a lysis of the tumor cells, and when that tumor cell breaks down, it can release electrolytes, and they can develop a hyperkalemia, hyperuricemia, hyperphosphatemia, and that puts them at risk for cardiac dysrhythmias, renal failure, and death. Rapid cell lysis due to chemo or no known cause. It's usually in acute leukemias and high-grade non-Hodgkin lymphomas. They can also develop septic shock, and they can develop hypercalcemia. Bone breakage releases calcium into the system. Hematologic emergencies include bone marrow suppression, anemia, and thrombocytopenia, and coagulation disturbances, idiopathic bleeding, and DIC. Tumors are a space-occupying lesion, and so it will grow and it'll start to compress the organ in that space. It's a limited amount of space, so that can happen in the spinal cord, the brain, and other organs. Collaboration, early diagnosis is better outcomes for some cancers, such as breast, colorectal, testicular cancer. Diagnostics, we talked about all of these in cellular regulation, so I'm not going to get into all of these, but there are tumor markers as well that include antigens and hormones and proteins and enzymes. Treatment includes surgery to remove the tumor. We talked about that in cellular regulation. I'm not going to get into the chemotherapy, all the different types, but there are a lot of types of agents, and in the Focus on Pharm, you're going to look at complications of some of these, and they may try radiation as well. Lifespan considerations, children and adolescents. You want to remember that it's care for the family, not just care for the child. Physical and psychological status you need to be aware of. Remember that it's an overwhelming diagnosis for the child, the adolescent, or the family. The developmental stage and their personality affects the reaction. Treatment has lifelong impact. We talked about this in cellular regulation. It can impair the growth of bones and teeth. They can develop osteoporosis or skeletal toxicity. They are at risk for secondary cancers, and they may have depression or suicidal ideation. Pregnant women, most cancers don't spread to the fetus. Sometimes there's a delayed diagnosis because the mom doesn't want to undergo testing or whatever else, everything else happening in their life at that time. And it's complex to treat a mom, expecting mom. Older adults, 60% of cancers are in those 65 years and older, and they do have a higher mortality rate because of chronic conditions or added comorbidities, and the chronic conditions impact their treatment. There are a greater risk for reactions between cancer medications and other medications, and there may have an interruption in their or a change in their treatment schedule for their cancer because of other medical conditions. They have a delayed recovery from cancer treatment, and we will work on the nursing process in class.